Okay, so today's topic is about histamine because I have a fair amount of patients with this condition called mast cell activation, and the histamine is main ingredient of that melody. So therefore, I wanted to talk about histamine, what are the mast cells, what is mast cell activation syndrome, what's the diagnosis and therapy. And the histamine is a chemical. You can see the chemical structure on the top right corner. It's produced from histidine, which is amino acid, and then it gets processed into N-methylhistamine and imodazolacetic acid. And you can see there are a couple of agents here that listed as blocking the enzymes that can convert the histamine into its metabolites. And I was actually looking up at those. And for example, quinacrine is similar to quinine that is used for malaria. And this quinacrine is used for different parasites and helminths and stuff like that. But apparently it plays a role in conversion of histamine to N-methylhistamine. It kind of blocks that conversion. And aminoguanide is a very interesting chemical that affects this diamine oxidase, which is enzyme helping to convert to this imidazole acetic acid. And guanidine actually was originally studied in diabetics to see if it will prevent kidney damages, because it's apparently reduces end products of glucose toxicity. When people have diabetes and high blood sugars, it can affect different tissues, and this aminoguanidine apparently supposed to prevent or counteract those, but it had too many side effects, and because of that, it never was studied beyond of phase 2. And then I wanted to share this one is pathway of anaphylaxis. Anaphylaxis reaction is a severe version of allergy, and it's produced by having different triggers. You can see here it's environmental allergies, and anaphylaxis is the most severe type of allergic reaction that can kill people, and therefore needs to be considered a medical emergency. And that's where people would have EpiPen to deal with that, because it can create all kind of throat tightness. As you can see, there's symptoms down there: flushing and tachycardia and pruritus, which means itching, shortness of breath, nausea, vomiting, diarrhea, and cardiovascular collapse. So all of that is very serious, and that's where the epinephrine becomes important part of this, of dealing with that. But where does the chemicals that trigger that come from? They come from mast cells and basophils, and you can see on the left mast cells and basophils, which are somewhat relatives, but apparently different type of cells. White blood cells, they do produce tryptase, that shown is in yellow, and in red, and histamine. And histamine is the one which is supposedly causes all of this flushing and itching and all kind of reactions listed in the left square. Then there are other type of pathways, could be related to T cells, monophages, monocytes, and you can see there are different chemicals involved there. And the reaction will be somewhat different. It will cause the fever and chills and rigors, nausea, pain, headaches, hypotension, and oxygen desaturation. And the worst would be if there is a mix between T cells, macrophages, monocytes, and as well as basophils and mast cells. And then there is a very different version of that, which just goes through complement, and it's still at the end will use mast cells and basophils, and still will create histamine and tryptase production. But instead of IgE and IgG as a triggers, you will have complement as a trigger. It's kind of too much into details, I guess, but I wanted to show that those cells, mast cells, are the ones which we are going to talk the most, and they will be associated with a lot of symptoms that are listed on the in the box on the left lower corner. You can see there. So what are the basophils and mast cells? And you can read here that basophils are rare cells, less than 1%.
Me.
They are the ones, they help our body to fight inflammation, infection, and at the same time, they could be an allergic triggers. And they have different granules that one of the main component is histamine, and that histamine is what will create the response. And the mast cells, they become mast cells after they get into different tissues, into gastrointestinal tract, into skin. So it's only precursor of mast cells comes out of bone marrow, but when it reaches the tissue and matures, that's when it becomes mast cells. And they have, you can see those bubbles, and those bubbles have mostly heparin and histamine. And they are the ones responsible for those multiple reactions, and we'll talk more about them. So what, there is an interaction between mast cells and all kind of cells in the body, and that's too many details there, but if you want, later on you can look into that, but it's interferes, or not interferes, it's plays a role in different reactions through action of different cells. And what is mast cell activation? It's mast cell activation is when those mast cells get degranulated easier than normally otherwise they would. And as a result, they produce those symptoms without kind of true biological need to be produced. And MCAS, this mast cell activation syndrome, is present in about 17% of general population, but in majority of people, it's actually undiagnosed. So what are the symptoms? So symptoms usually not like in true allergy where you would have constant runny nose because you are exposed to dogs or dust. It's more waxing and waning and migratory, and they still have triggers that can trigger them, but they do affect all tissues or all organ systems. For example, with skin, you are expected to see flushing and hives and a red dermographism. And red dermographism is when you scratch your skin, and some people will develop raised, itchy, kind of elevated itchy skin in that area where you scratched it. And you can check on yourself right now and see if you are developing it or not. So that's part is on the skin. Then people do develop irritated eyes, nose, mouth, throat, and can get adenitis, which is technically lymphatic tissue, swelling in lymphatic tissue. The cardiovascular and pulmonary, it could be associated with wheezing, shortness of breath. Many people will develop orthostatic hypotension, blood pressure and heart rate variability, and in many people it will be POTS. And some of you have heard what is POTS. It's postural orthostatic tachycardia, so it is part of this MCAS. The gastrointestinal will be nausea, GERD, abdominal pain, diarrhea, but frequently it will be alternated with constipation. genitourinary will be interstitial cystitis, painful periods, and heavy periods. Many people will have fibromyalgia type of pain, and many people will have hypermobility. And many people with hypermobility, especially EDS, may have version of MCAS. Then there could be some abnormal growths, benign abnormal growths, poor wound healing, and neurologically, it's fatigue, cognitive dysfunction, memory loss, headaches, different versions of neuropathy, thermal temperature dysregulation, feeling too hot, too cold, so that's all could be. And as a result of that, there could be anxiety, mood disorders, and many people will have thyroid problems or other endocrine issues. So there are things to consider that we want to say that no, it's not MCAS. There is apparently a recent diagnosis of hereditary alpha-tryptasemia, and that's the one apparently more frequent in people with endless and it's kind of high level of tryptase because of repeated gene expression in certain place. Then the most serious ones would be mast cell neoplasia, meaning leukemia, and there are other versions of leukemias, not only mast cells, but other leukemias needs to be ruled out. Then C1 esterase deficiency as a cause of hives or angioedema. There could be histamine producing carcinoid, which is different version of tumors, severe kidney disease. And there are many other conditions that obviously can look like portions of MCAS, but in order to say that it's MCAS, it's you have to have criteria. So what are the criteria? So there is this consensus from 2019, and they will say you have to have at least 2 organ system involvement. So for example, gastrointestinal, you have diarrhea, and let's say you have hives. So at least those 2 need to be present, or wheezing, like recurrent asthma, and diarrhea. That could be another thing, or such. Criteria B is documented biochemical numbers. So there is a chemical tryptase, and you saw that coming out of cells, basophils, and mast cells. But if we have certain triggers that we know that can increase, that can cause reaction, if you check tryptase level before and then after, within first 4 hours of this trigger, you want to see that level of tryptase went up 20% plus 2 nanogram per milliliter, sorry. So for example, if your normal level at the baseline is 5, which is actually within normal limits, but after trigger stimulation, it went up to 8, that will be sufficient to prove this criteria and will be part of this diagnosis criteria. So then criteria number C is a response of symptoms to therapy with mast cell stabilizing agents and such. So if you have those 3 criteria, then there is good chance that you have a diagnosis of mast cell activation. It's interesting to notice that mast cell activation as diagnosis was established only in 2007. Prior to that, people did not have that as a disorder, even though it was kind of recognized in 1986 or 7 when first case report was published, if I'm correct, but definitely in 2007 when it was recognized first in a sense. So there are primary cases when there is some clone of mast cells, not cancers, but still clone of mast cells that have special type of mutation, and it's could be done with a bone marrow biopsy and needs to be confirmed. So that's one subtype. Another subtype, a secondary one, it's more related to presence of actual allergies, and it's IgE-mediated allergy. And there could be idiopathic ones where criteria met, but we don't have actual mutation, or we don't have IgE-mediated allergies, and there is no cancer of any kind anywhere. So those are three versions of MCAS. And what is the proposed treatment plan? So first you have to find out what you are dealing with, and after you figure that out, the treatment plan will be blockade of histamine receptors, and you want to blockade both H1 and H2. And H1 and H2 would be examples. For example, famotidine. Famotidine is stomach pain, but it's one of the blockers. But you want to combine it with, for example, Benadryl or cetirizine or such. So you want both blocked, and usually it's at higher dose than regular ones. Then there is leukotrienes, another chemical that can be produced by mast cells. It's Montelukast, which is singular and couple of relatives. And it's interesting that Ziluton does both. It's leukotriene receptor antagonist, plus it reduces production of histamine as well. And that's why it's in both in leukotriene receptor antagonists and in inhibition of mediator synthesis. And aspirin will be in that category too. So for some people, aspirin could be bad because it actually will trigger their mast cell activation. But for some people, apparently, it can be helpful. Then another thing is mediator release blockade. It's sodium cromolyn. We usually use it more for nasal, as a nasal spray or ice drops, or even for asthma, you could use spray. It's kind of actually powder that gets inhaled. And apparently you can get that as a drink for people who have gastrointestinal symptoms. And that's supposed to reduce the production of histamine or release of histamine from gastrointestinal tract or the eyes or the nose or lungs. Then we can bind immunoglobulin E, because it's one of the triggers, by different injections, like or different medications like omalizumab and such. Then we can work on actual mast cells by tyrosine kinase inhibitors, and there are several of those that is technically used for lymphoma, leukemia, and many other cancers. And right now I do have one patient who is getting this type of agents because her case is so severe that her providers for that decided that she needs to be on one of those super heavy duty medications. And then when there is an acute situation, which frequently people for more or less no reason will have hives, develop hive or angioedema or even full-blown anaphylactic reaction, then you want to treat with epinephrine and steroids, bronchodilator, plus everything on the list above. And there are a few other agents that listed here that I didn't yet mention, and that's from different articles. And again, if you ever need this information, let me know or take a picture of this.
I have a question about doxepin.
Yeah. Mm-hmm.
Is that the drug that some people, I think my husband took something that sounded a little bit like that, and he had trouble getting to sleep. But once he got to sleep, what the drug that he took kept him asleep. Is that doxepin?
It can be because it has tricyclic antidepressant activity. It's similar to amitriptyline and nortriptyline. And nortriptyline we frequently would give people for sleep, and it has those potent H1, H2 antihistamine properties apparently. And yes, it does help people to sleep and
But it also helps depression.
yes, it does
I
help.
think that's what my husband took. Yeah.
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 Very, very cool.
Doxepin. Okay.
And so yeah, you can see the other ketotifen is interesting because it's here as well used as a blocker and for allergic eyes. So, okay, and what you can do on your own, you can actually, if you suspect that you have something like that, you can actually try low histamine diet. And I pulled out this article that compared 10 different research articles, and the overview of those 10 reviews or 10 articles in this review said that foods were different because there were slight different assessment of what is high histamine and what is low histamine diet. But what definitely was excluded is fermented food, because fermented food are high in histamine, even though we love fermented food because they have all kind of probiotics and prebiotics, but because they have high histamine, and if you have, for example, tendency for those hives or other things, as I mentioned there, they could be bad for you because they have too much of histamine. Then they suggested that 32% of food, exclusion of 32% of food could be explained by occurrence of high histamine. And then there are foods that will affect DAO enzyme. And you saw in the beginning, we had that DAO enzyme that helps you to get rid of the histamine. So if you're eating a food that will either increase degradation of histamine or reduce degradation of histamine, then obviously that particular food can affect how you feel. And therefore, you may want to get rid of, for example, citrus fruits and bananas, because they are one of those that will affect the DAO enzyme function. Then there were some food that are histamine liberators that not yet clear how they work, but apparently they increase liberation of histamine and therefore should be excluded too. So again, many good foods on a high histamine diet or high histamine list, and therefore the low histamine diet is quite difficult to do, but many people with mast cell activation find it quite useful. And until you, for example, if you have secondary cause of MCAS, and you can work on your allergies whichever way you can, working on your gut health, working on other underlying condition that can trigger your mast cell activation, you can actually improve it. I've had quite a lot of people who over time their MCAS got better, and because they were working, they eliminated initially everything that possibly triggered them, and then over time they healed their guts. They worked on other issues like stress and sleep, and altogether they got into much better space, and therefore their mast cell activation has improved, and they were able to reintroduce many products from the list that initially they excluded. So And that's pretty much it for right now. There are possibilities of talking about supplementing of this DAO, of this enzyme that helps you to get rid of histamine. There are capsules that you can actually take, and that will help you remove excessive amount of enzyme or of histamine. But again, you have to remember that it's maybe challenging depending what's your level of histamine, because if it's just a little bit, yeah, maybe enzymatic support will be helpful. But if it's too much, there are probably not enough of enzyme to, you cannot take enough pretty much. Okay. What else? Naturally antihistamines. Natural antihistamines will be quercetin. We talked about a lot about it. I take this kind. Doesn't mean that you have to take this kind, but anytime you take quercetin, you want to have a little bit of vitamin C, but not too much. This particular one has 100 milligram of quercetin. It's a little bit on the low side. If you want to have anti-allergy effect, you probably want between 250 and 500. This one I take more for kind of anti-aging in a sense. We talked that quercetin is anti-senescent agent, and therefore I want to have it. And it has only 100 milligram of vitamin C, which is not too much, because if you take
Can you spell that?
Quercetin, Quercetin, and as said, you take it together with vitamin C, and that this one has it, and plus this has rutin, and rutin is another vitamin which is, I don't know, you cannot see here.
Back it up a little bit, pull it back a little bit.
Yeah.
Oh, I can, that's better. Yeah, okay.
So rutin, R-U-T-I-N, is not agent that stabilizes blood vessels. It helps vitamin C to work better, and somehow it is part of vascular stabilization. Like I take it when I have extra bruising. And I've noticed that many times I would give people with extra bruising and absence of any other causes of that extra bruising. I will give their rutin, and their bruising will improve. So yeah.
And that's also naturally found in, I believe it's onions, broccoli, green or black tea, berries, and grapes.
And apples. Quercetin is in apples too. Stinging nettle.
Oh yes, stinging nettle. Yep, that's another good one.
Yep. Good. So I will stop the recording.